Hi, everybody. Welcome to our webinar today. So our topic, as you know, is youth e-mental health and virtual services. Before we get started, I just want to let everybody know that we are recording this webinar. So if you have your video on, then you will be seen. So first, about me. So I'm a student at McGill. I'm a member of the Access Open Minds National Youth Council, and I'm involved with Kids Help Phone as the National Youth Council Chair and a member of the Board of Directors. So our topic today, youth e-mental health and virtual services, always an important topic, but especially in the context of COVID-19, where we're seeing a real youth mental health crisis. At Kids Help Phone, for example, we've seen a 112% increase in service demand compared to this time last year. So clearly COVID presents a lot of challenges, opportunities, and then inevitable change. This sector is never going to be the same afterwards. So we are going to address all those questions today. The flow today, we're going to have a series of prepared questions. Panelists will respond. You can write your questions in the Q&A box at any time. And then after the moderated discussion, we're going to have a quick 3-question poll. And then our panelists are going to start answering the questions that you have presented. So I'm going to get our panelists to introduce themselves. We can start off with Marianne.
Hi, Matthew. Thank you for that. Yes, so my name is Marianne Levasseur, and I'm a family peer support facilitator at PEPP Montreal, part of the Douglas Mental Health University Institute. So I'm working and doing peer support with families of youth experiencing psychosis. I also am part of the Access Open Minds Family and Carers Council, and I've been working with Access and the council for almost 6 years. And I'm also a co-founder of Patient Advisors Network, which is a network and community of practice by patients and caregivers for patients and caregivers across Canada.
Perfect. Thank you so much. And the next, I'm going to throw it over to Ina.
Very nice to be here. Thank you. My name is Ina Winkleman, and I am a coordinator of the Youth Mental Health Program at the CIUS West Island, which includes some community mental health services, some more specialized second line services as well. I was the former director of engagement services and engagement at Access Open Minds for the past 3 years, which has been a wonderful experience. So glad to be back in the Access family. And now, well, through the pandemic, the beginning of the pandemic, I came back very quickly into the clinical services where there was a need, and I've been back since March. Happy to be here. Thank you.
Thank you, Ina. And next up, I'm going to call on Alicia. You might be muted, Alicia. Oh, Alicia was kicked off the call, unfortunately. So I think she's going to try to get back in. But for now, I'm going to call on Manuela.
Thank you. It's really a pleasure to be here with you today. My name is Manuela Ferrari. I'm an assistant professor in the Department of Psychiatry at McGill University and a researcher at the Douglas Mental Health Institute in Montreal. My work, it's connecting to digital mental health, and I use participatory design to really create intervention that can promote access, treatment, and engagement of service user in a mental health setting, but also in the creation of the technology.
Okay, fantastic. Thanks to all of you. I think we can move on to the first question, and when Alicia gets back on, we will just take a pause, let her introduce herself, and then continue. Our first question is about the challenges facing the sector during COVID-19. So what challenges have you experienced or have you seen in regards to youth e-mental health and virtual services during COVID-19? First, I'm going to ask Marianne to opine on that. And you're still muted, Marianne.
Sorry, thanks, Matthew. So working with families of young people experiencing mental health concerns, and also working on other projects, both in e-mental health and mental health services. I think one of the challenges especially during COVID right now, and I guess it's a challenge in general, is access to e-mental health and virtual services. So for instance, patients who are in hospital, there's very limited access to being able to use virtual services, and there's limited or no access to be able to connect with family members unless you have your own device. So hospitals don't seem to be providing that evenly. You know, the e-services are not evenly distributed across the country from what I've heard. Also, I think that you know, getting access to e-mental health services and virtual services might be more difficult for people who are from disadvantaged backgrounds, who may not have the means or the support to be able to connect with those services. So there's a difficulty there. And also I want to bring up youth who are either incarcerated or part of youth protection services. Once again, for various reasons, they may not have access to e-mental health or virtual services, which may be beneficial to them in the long run. So I would say that a number one challenge for me and from what I've been dealing with is access to those services.
Thank you for that. We have Alicia back on the call, so I'm going to throw it over to her for a moment to introduce herself.
Hey folks, my name is Alicia Armando. I've been working in virtual care and virtual clinics for quite a while. And right now I'm working with Foundry BC's virtual clinic. And I'm really excited to talk to you all about e-mental health today. And when I was a young person, which I am no longer, I had a preference to access e-mental health services. So hello, and it's great to talk to you all today.
Perfect. And Lisa, I'm also going to ask you the first question while you're speaking. So that's about the challenges that you've seen in regards to youth e-mental health and virtual services during COVID-19.
So I think one of the things that's been really cool about one of the really cool things about the time that we're in right now, even though it's a scary and terrible time, is having worked in e-mental health for a long time and having a lot of resistance and the same questions over and over again has caught, like, all of a sudden that's all gone away because we all just really want to serve the young people and families that that we're meant to serve, and online is a good answer to that. I think part of the challenges that I have seen is because folks didn't really want to be in this space before COVID hit. They didn't really do the research of how to do. They didn't really have training or didn't know how to do the research of how to do virtual care ahead of time. And so that was, I think that's been a big learning of just trying to get everyone the training that they need to provide services online, but also around security. So understanding what platforms are secure, what platforms, and there are a lot of the platforms you may think are secure or are easily low barrier to young people and families are actually not secure. And so I think it's been one of the bigger challenges of just kind of not thinking about this before COVID meant that we didn't really have the right training or have the right security assessments to kind of know where to offer things. And I think it's, you know, and I appreciate and I have so much respect for our counselors and our teams, but I think it's also, you know, there's a lot of discomfort for people just trying to figure it out and trying to offer services online. And I think it's scary for the counselors and peer supporters and everyone to be operating in this new way. And I think that sometimes leads to funny tech problems. And one of the things that I've seen a lot throughout my career is just when people are frustrated with a tech platform and instead of just asking for help, they just start clicking a bunch of things and then they break more stuff. And so I think that's the other thing too, is I'm really honored to see the resilience and the adaptability of our service providers, but it is a platform they're not used to working in. And so sometimes things break and that causes a lot of like panic in them. So, yeah.
So it seems to me that this is sort of an inevitable shift towards digital over time, but that COVID's just really accelerated that. So you see, Alicia, I'm sure, a lot of problems that because of that acceleration. And do you think that we're going to come out of this more technologically adept, or are we just going to have a lot of issues for a long time still?
I think people have really learned, just even seeing our counselors and even having peer support teams online outside of the time of COVID. I think the longer you do something, the more you learn, the more you adapt to it. I think it's really shown me the importance of good tech support too, to just help people make, as they're learning how to make the most efficient changes and stuff like that. And efficient ways of doing things. I've definitely been called in to support people and realize like, oh, you're doing it the most like roundabout, least efficient way, and you really just click these 3 buttons. And so I think that'll be really helpful. I think when in-person places feel safe to open again, I think we might be offering virtual as a choice. I think it's been stressful for some of our young people and our families too, because they wouldn't have chosen virtual, but they need support. When we have a vaccine and we go back to normal life or whatever that looks like, I think it'd be really awesome to keep this choice for the young people and families who want it, and also respect that some young people and families, once in person's an option again, will never go online again. It's just how they're getting their support right now.
Perfect. Emanuela, in your work and research, what problems have you experienced with regards to COVID-19?
I kind of echo what has been said, and I wanted to step back and make a comment about it. I feel we are actually lucky working in youth mental health, because we had young people that told us that we had to move and use digital technology, even if the researcher or provider didn't want to. So I've been telling us for a long period of time, and so we were some way prepared, but a little bit more need to be done. And as Marianne said, we have issues connecting to access. So both from the technical infrastructure as standpoint. So we know that different places have different resources, different people have different resources, and different comfort level with technology. So all of those elements are important. Policy, provinces have their own policies that need to be respected and used. So all of those elements, need to be taken into consideration. I want to open up also the discussion in connection to bringing technology into settings. So one thing that we learn even from the business world, for example, they use technology as a way to scale up their business. We actually know that there are a few challenges connecting, and one in particular is connecting to the culture. So we can actually have the best technology available and the resources to buy this technology, and there are technology up there. There are companies, they have very interesting product that can be adapted, that we can use actually. But is the culture, the organization ready for it, right? Are the people ready? And what I say, pushing down or not being aware of this readiness level of people working in a context of the organizational, it can be a disaster, right? So one of the big challenge for me is, yes, we are rushing into it, but are we ready? Should we actually pause and assess what is the best solution for us, how people feel about it? Alicia made an excellent point. Providers, some of them are feel comfortable, are not, but the same thing is for family member or service user. So we all need to be a little bit mindful and understand. And I think there are key aspects that can help us in, so creating awareness about the option that we have, engaging people in discussion where we bring into technology into. So all of those, like communication or communication. And in particular, I'm very interested also in the co-design. So both the adaptation, working with different stakeholders, but also like creating new intervention, working together. I think will be, will create a sustainable solution. So that's some of the elements that I think are important.
Great, a lot to think about there. Does anybody have any other points to add off that, or any other points about challenges before we move on?
Yeah, Matthew, thank you. I could add just a couple of points. I think as a service provider supporting teams, Alicia spoke a little bit about how most of our clinicians and frontline youth mental health workers have adapted so quickly and so amazingly to this new context and really embraced sort of this new approach. I think it's been I think COVID has been yeah, definitely a blessing to move things forward much quicker than it probably would have moved. But it's been a huge learning curve, and I think as a service provider, it's allowing staff to make mistakes and to try different things and to get familiar with the different regulations that have come down from the government, from the organization, from the professional orders, as Alicia was saying, using secure software. So as an example, we started off really, when the pandemic started, we had to reach out to our young people. So we were using a free version of Zoom that everybody had downloaded on their phone and could use for 45 minutes at a time with one user maximum. So we were using that, very conscious that it wasn't the most secure, but it's what we had. I think we felt at that moment that the benefit outweighed the risk, just to create that first connection, making sure people weren't left without any services. And then we're very grateful then when we had access to more secure servers. And so it was a tricky situation. I think finding that balance of yes, wanting to do what's right, what's ethical, making sure it was confidential and everything, but also not letting that bog us down and get paralyzed and not do anything, because it's very easy to get paralyzed, especially in large healthcare systems where we want everything to be perfect before we implement it. But during a pandemic, you don't have that luxury. You can't just be paralyzed and not reach out and help people. So it was, I definitely think that was the biggest challenge, is just making sure that we had that balance, yeah, between the two.
Sorry, makes a lot of sense. And I guess with technology too, nothing's going to be perfect until you try it and you find the bugs and work those out. So I guess this is a good opportunity for that. Just a reminder to everybody that you can put your questions in the Q&A box, and after a moderated discussion, we will be going into those. So unless anybody has more points to add on challenges, we are going to move into opportunities. So I'd like to know some of the key innovations you've seen in the youth e-mental health and virtual services space since COVID-19, and what you've learned from these innovations that you can take forward past the end of COVID. So I'm going to start off with Alicia. Do we still have Alicia here? If you're on, you're muted, unfortunately.
Hello? Oh, I'm having some.
There we go.
I'm just having.
We can hear you now.
Issues, so
Can't see you though.
I'm just feeling with that. Sorry, folks. I don't know what's happening. Can we go to somebody else first, and I will answer?
Absolutely, we can circle back. So I'm going to ask Ina that same question about the innovations you've seen in youth e-mental health and virtual services, and then what you've learned from these innovations to take forward past COVID.
Yeah, thank you, Matthew. I mean, I think definitely there's been a lot of innovations in a short amount of time. I don't know, I mean, or I guess I'd say opportunities. I don't know if they're innovations, but definitely small. I'll scale it down to opportunities. I think definitely staying connected despite the pandemic, I think, is definitely an opportunity that was seized through these virtual services. As an example, in Quebec and Montreal, we were able to start connecting with young people even before the schools did. Before the schools were able to sort of set up their virtual classrooms. And I think that was definitely an advantage, so that the young people had someone to connect to right from the beginning of the pandemic, whether it be by by phone or by Zoom. So I think that definitely was a great opportunity. We've also been able to quite quickly, I think, I mean, if we think that the pandemic started in March and we're only in June, to really start offering some virtual therapy through the Zoom platform. So an example of that would be a DBT group that was really just adapted in a matter of weeks to a Zoom setting. So I think that was very exciting for the team, very scary and exciting at the same time. I think for the young people that started participating in these groups, it was, again, sort of a very first time to connect with other young people that they hadn't been able to do outside of that context. So that definitely was a great opportunity. I think too, the kids and youth are very tech savvy. So for them, it wasn't a huge adjustment, it seemed. So again, I'm speaking from the personal experience of the youth mental health teams that I'm managing here in Montreal. So I don't want to say that was the case everywhere, but we really have the perception that youth really switched over very easily to this new way of seeing their therapists and their workers. We also, again, another perception is we had a lot less youth not showing up for appointments. So it seemed like just the facility of being able to connect while at home or wherever, hopefully at home during the pandemic, but just made it easier for them to be able to attend appointments. So that definitely also was a great opportunity, something that we've seen. Yeah, I think that's it for now, I think.
Great. So Alicia is having some tech issues with her computer. We're going to try to get Alicia to answer another question here. Oh, looks like she might be back. So we'll see how this goes. But the question was just about the opportunities and the innovations that you've seen in youth mental health and virtual services since COVID, and then what you think we can take from that going forward after COVID.
Yeah, I think it's been really cool to see, I think, more diversity in the people that and the people who are coming in and asking for support. Like Foundry now serves the whole province with the virtual care, and so we're getting a bunch of people from the usual places, but also a lot of people from communities where Foundry centers don't exist, and also just kind of like being able to be there for young people who would find an in-person place inaccessible, like regardless of how long the hours are or how convenient the location is. I think one of the things that has been really cool has been young people just kind of getting to the meat of their issues. So we offer 3 different modalities, so people can do audio calls, like they can do audio, video, or messaging through the platform that we use. And I think people have been kind of using that and kind of opening up a lot faster than they normally would with a counselor. And I think that's been really awesome. And them able to message us and support us has always been the case with virtual, but I think now people are figuring it out, like when people can message you or talk to you from their safe place, from where they feel safe in their room or wherever, and how that changes kind of how they approach the session has been really cool too. And I think it's also been a really great opportunity to be really creative in terms of like, how do you do an art group online? Well, you can just like talk about, you can have a theme and then everyone brings or makes something based on what they have in their house already. And just kind of some really creative things. I think one of the things that has been, it's an opportunity, but I think it's also jarring when you're doing a video call with somebody and they don't live alone. Or even if they do, you learn a lot more things about them than you maybe intend to, about like what their home life is like, how messy their room is there people screaming in the background, and kind of how to respond to that, even though that's not something they intentionally told you. And yeah, I think those are kind of like the biggest opportunities. I mean, I'm just excited to be able to offer the option to the young people who've been asking for it for a while, and have a lot of and I appreciate that some young people will not want to do this after this is done, but I think there's going to be a lot of them who will be excited to be able to have their counselors meet them where they're at. So yeah,
I really like what you said there, and the point about how I think oftentimes we look at e-mental health services as being poor substitutes for in-person services, or at least there can be that perception sometimes, and then it's just a matter of convenience. But the way you frame that as if people are in the comfort of their own home, they might feel more comfortable, more open. There are many upsides to it as well. And I think that, like you said, having the option to go in person or virtual for services is just so key here. If anybody else wanted to talk about the opportunities here, then we can put some time in for you. Otherwise, we can move on to the next section.
I'd just like to add on to that a little bit, Matthew, with regard to opportunities and innovation also. I think there's been a great innovation in the realization of ideas onto the internet from all sorts of organizations, institutions, government agencies, and not-for-profits. We were just inundated. We've just been inundated with, ideas for e-mental health, for helping people in times of COVID, and so to see this great influx all of a sudden of services, ideas, and opportunities creates a bigger opportunity in my mind because of what we've been living through, a greater opportunity for collaboration. So we've seen a higher level of collaboration among people on community level, but also on government level, and a provincial and territorial and national and even international levels. I think people are more willing to work together. I think they're finding ways to work together. So if anything, the opportunity would be not to let this go and to sustain it and to further it, by connecting actually more through e-services. It's just something that I think is a turning point in our ability to connect with each other and to collaborate in a positive way. So that's what I see as innovation and opportunity.
I think that's a great segue too. You speak to this being a turning point and going forward, and how we need to work on things going forward surrounding this and the issues that came up from COVID. I want to talk more about post-COVID and the opportunities that you see for youth e-mental health and virtual services in our post-COVID world. How has COVID changed this landscape? What limitations and risks can you see? And then I guess the key benefits you see going forward. So first, I'm going to pass the mic to Alicia.
Hello. So we're talking about the benefits going forward, and yeah.
Exactly.
Okay.
Yeah. So you can feel free to weigh in on that now if you'd like, or we can pass it off to somebody else if you wanted some time.
Yeah, let's go with somebody else first. Sorry, I'm still getting
Sure.
I'm still getting a weird delay and everything's freezing. So
No problem.
Thank you.
Okay, so we'll pass it to Manuela then.
So I'm actually connecting with Ian and Marianne were saying, and I take a little step forward. So we have this adaptation, and some of them are innovation, right? Are gonna here to stay, and we find out that wow, it was being quite interesting, in quite interesting experience. We got pushed to do that, but we've been learning so much. And Alicia also was mentioning other aspects of what we are discovering, good and bad, in entering in someone else's house and providing care in that interaction dynamic. And not to say that providers are also actually in their own house sometimes when they're doing that. So it's a different vulnerability, I would say. But another important part is we are adapting, but my question will be, and that will follow up to the audience, how about if we use this as an opportunity for a digital transformation in mental health? Really, we are, sometimes when we talk about using digital technology in care, we have different levels. It can be just recommending a tool to a person or using some digital technology in clinical settings, so for assessment, monitoring, in a way where we truly integrate all the care, and the care can be provided digitally, online, remotely, and that's what we are experiencing right now. So out there to people really can we actually use this as an opportunity at a new transformation for youth mental health setting? And looking just a couple of points that I want to bring to the table also, that in embracing technology in our practices. First, to me, it's the opportunity to work in interdisciplinary team. We already know how important it is to do it, and including team, they also involve the lived experience. Now we have a new step, because we are using technology, we have experts of technology, they need to come and work with us. So IT staff, you know, and especially also IT staff, for example, they have lived experience, right? And data analyst, a designer, graphic designer that can make our interface user-friendly. Like imagine, we really need to have all of this knowledge coming together and help us. Because one of the aspects also that was said before is the part of technology, we can adapt it quickly, and we should adapt it quickly. We should not wait years to change an interface if it doesn't work. It has to change quickly, right? That's the benefit. So I think that's an important part. We also need to help both provider as service user, family member to move from which is also very important. So the experience of changing treatment according of what the perception of during the interaction to maybe having data that are coming in to guide some of those changes, right? Using assessment and monitoring can help us to make decision. And I believe in, you know, it's important shared decision making. And an opportunity to develop new level of training, for example, so that everyone feel comfortable in the use of technology. And we know, you know, what we just generally, we have been talking about technology in general terms, but we know that there are so many different aspects of technology and intervention as well. So we really need to also be as best consumer of technology as we can, and everyone within the organization has to have access to this knowledge to make the best decision for the young people that we are seeing services, the family member, and the staff that are providing frontline help. So just a couple of aspects that I think are an opportunity for us.
Perfect. A little question on data for any of you who would like to answer. You guys just got me thinking. In terms of collection of data in service provision, what are the big differences between when service is delivered in person versus when it's digital? What sort of data can you collect or that you can use to improve service delivery or technology when you do it virtually versus in person? Any thoughts on that?
So I can take, and I will also make a distinction between clinical data and research data. And maybe we can start with the clinical data. You know, we talked before about the idea of any platform need to be approved or work and operate under a provincial policy, privacy policy, as well as the collection of any personal information. So usually those are kind of standard guidelines, right? Now, after it depends which kind of data, right? Because you're talking about the image data, they answering a digital survey, providing information about symptoms. So all of those levels are, you know, like need to be unpacked and explored, taken into consideration. But most of it's connecting to clinical data, and after it, how you protect them. And, you know, as we have protection within physical setting, we have protection also in digital setting. So make it kind of simple in that.
I think you made that as simple as it can be, given the time we have. So
yeah,
I appreciate
and
that.
I didn't want to take too much time from others.
Perfect. Thank you, Manuela. I'm going to turn it over to Ina now with that same question about opportunities for post-COVID.
Yeah, I mean, I definitely echo, I think it was Alicia who said, you know, now that like when in person is possible, virtual is a choice. I love that. I wrote it down. Thank you, Alicia. I'm going to be using that in the future. I just feel, yeah, that it's just a great additional way that we can reach out to young people and just always, you know, I mean, it's just increasing the choice and methods I only see the benefits of that, definitely. I think what's going to be nice post-COVID is just maybe taking a little step back, and because we've done everything so quickly, really just responding to the immediate situation, it'll be nice to take a little step back and to kind of reflect on sort of, I know somebody put it in the chat as well, the question of evaluation, and you spoke about that as well, Manuela. So, you know, just getting feedback from young people, from families. Do they like this new format? You know, does it meet the needs? Is it, you know, is it helping clinically? Are we seeing good outcomes? Are we seeing different outcomes in person versus virtually? I've seen a lot of sort of research projects pop up in the last couple of weeks, kind of through my inbox, my email, where researchers are looking at just that. So I think that's really exciting for us as clinical teams to partner with researchers and to be able to evaluate this new way of doing things. So again, just taking that step back. But I think it is possible, as Alicia said. I mean, we've got an art therapist who's attempting different ways of doing art therapy over Zoom with you know, very small kids. And so when I see that, and I just see the effort being put into that, and the feedback of the parents and the kids, and how honored they are to have been selected for a Zoom art group, I think anything is possible if that's possible. So yeah, so it's really exciting to see. I think yeah, I think there's a lot of opportunities, and I hope we keep going in this direction.
Thanks, Ina. And on that same question, I'm going to throw it over to Alicia.
Yeah, I think a lot of what I was going to say has been covered, but I think it's, for me, I think the opportunity really is, so in my experience, virtual has done really well for young people who are incredibly busy or who have a lot of competing priorities in their life in terms of like going to school, working, and maybe taking care of their family. And so virtual, in person, it doesn't matter how accessible your in person is, for folks like that, it's never going to be enough. And so virtual really helps those young people be able to access things. It's also been really helpful for, in my experience, of young people who have had bad experiences with the system, and we're not asking them to trust us enough to go to the other side of town, pay for the bus ticket or get the ride to get that service. If we could meet them online first, then once they feel comfortable with us, we can make that transition into in-person services if needed. And this is obviously not the case for every rural and remote community, but definitely any rural and remote community that has good Wi-Fi access or internet access can be able to do that. A lot of platforms, and the platforms that I have worked with and I have chosen, have been ones that are work really good in low, like don't require a lot of Wi-Fi. They're not like really heavy platforms. And so for my tech issues today, you can see Zoom is not one of those. But things like Microsoft Teams and some other ones are specifically built to work with low Wi-Fi, and they're pretty successful in doing that. But I think for me, I'm just really excited for, one, to get different kinds of young people and families in who need these kind of options to be accessible to them, and to be able to even sometimes meet the same young people, but in a way where they trust us or they talk about different issues online. One of the things that I don't know has been covered yet, but this online support is a great opportunity for the trans and queer communities who are not out yet, but who want to receive services. It's safer for them to do that behind a computer than it is to do that in person, depending on like who, they don't know how people are going to accept the fact that they're trans, or how people are going to accept the fact that they're gay or queer. And online is a great place to do that. I also think, and one of the things one of my young people said to me once was, I don't really feel a connection to a place. I feel a connection to the internet. And a lot of the people, there's a lot of young people whose whole entire community lives online, and in-person services in their community who's set up to understand the local community still don't understand that young person, because they don't understand the memes, they don't understand the communities, they don't understand the fact that, you know, the stuff we're seeing right now with Black Lives Matter has been happening online for almost 10 years, and it's not new to them. And so it's a really specific kind of young people that we don't always serve so well. So I'm really excited for us to be able to do that.
Thank you for that, Alicia. If anybody has any other points about the post-COVID world, feel free to bring them up now. Otherwise, we are going to move on to key takeaways. I want to be conscious of time, so I'm just going to get everybody to share some key takeaways and recommendations you'd like to impart on the folks here on this call about youth mental health and virtual services. So first, I'm going to ask Marianne to talk about that.
Thanks, Matthew. Yeah, I think some of the key takeaways for me anyway, in working with family members now, having made the transition also online to online services, and building off of what Alicia just said, is that you know, I've had the experience where people that I really never met in person, I only dealt with on the telephone, in peer support, I now am able to see online, and we're able to have meetings online. So it seems like it's easier for some people to be able to connect online and to, you know, to interact with others in that way. So for some people, for sure, for some groups of people, this is, you know, moving toward more online services, whether it's in mental health or other services, is going to be a blessing for them. It's going to be easier for them to connect. I think that we have to be careful though, because even with in-person mental health services, a lot of people fall through the cracks due to many reasons, including inability of the service provider to accommodate everybody, or inability of the service user or family member to access services, or, you know, there are many reasons why certain people just don't get the services that they need. And we may have a tendency to think that e-services will solve that problem, and that everybody could just, you know, find e-services and get online, and it's not true. People still fall through the cracks. So we have to be, I think a takeaway message for me is to be aware, to be very cognizant that we still need to live in our communities, in our real communities, and we still need to interact with those communities on a regular basis to get the pulse of the real people. So, and so I guess my recommendation for post-COVID, or, you know, just going forward with e-mental health, is that what I noticed is even though a lot of things are popping up across the country, and I'm learning so much more now, you know, I've entered a whole other world now myself, I have to admit, because I wasn't really using those services before. I do still have to do some quite a bit of searching to figure it out. And it would be really good if we take this opportunity now, while we have everybody collaborating with each other across the country and across the world on these e-health services, e-mental health services, to get a round table going of, you know, top people in the industry, top people in healthcare and education, and just get us all together to figure out how we could do you know, a real World Wide Web, where we have a repository of services that are accessible, easily accessible to everybody, where we don't have to figure it out all the time. We can just basically click one or two buttons, and then we're led. We have a navigation system. We really need a virtual navigation system to be able to have ease of access and ease of building capacity to participate in e-health services. Okay, that's all I have to say.
Perfect. Thank you for those insights. That was great. Next, I'm going to ask Ina to do the same.
Perfect. Well, first of all, thank you, Marianne, to say for your comment on not forgetting that we live in real communities. I think I definitely echo that as well. So yeah, I think that definitely I would caution too that we should be cautious. I think Alicia said it too, that we, as easy as online and virtual care is, and how accessible it's becoming, it shouldn't completely replace in-person and you know, care that is yeah, very human, and that does require, especially in mental health, I think it does require that person-to-person contact. So I definitely agree with that as well. And I think my takeaway or recommendation is for services, to not be afraid to jump in. And I've said it before, we're going to make mistakes. We're going to have very not perfect situations, whether it be, systemic or systems issues, or even privacy concerns, things like that. When you are, in the home of somebody else through Zoom, or it may not always be perfect, and that's okay. I think in-person services aren't perfect either. So I think, it's been great to see people mobilize and trying different things. So I would just, encourage people to continue that way. And I think my last thought would be, I'm very passionate about youth mental health, having, just been fortunate enough to be connected with Access these past few years. I think this is really a place where youth mental health can shine, where we can be leaders, and not just within mental health, but above and beyond mental health. We're working with such great young people who just have already all this knowledge about technology and are just, natural at it. And so if we give them that space to guide us, and then for us to guide perhaps other areas of healthcare in terms of these virtual services, I think we could really become leaders, and have something to share that's positive. So that's how I'd like to end it. Thank you, Matthew.
Thanks, Ida. And next I'm going to ask Alicia to give some closing thoughts.
Did it work? It's okay. I think for me, I'm really, like I said earlier, really excited that now people are kind of getting on board and wanting to participate with this. Just even looking at some of the Q&A questions, like there are Foundry centers and I think integrated youth hubs all over Canada who are doing like D&D groups online, or doing video game groups where people play a particular video game together over, like, while streaming over Zoom or Discord or something like that, to be able to like connect and do something. I think there's a lot of really cool opportunities, and just a lot of like really cool, like watching the opening up of people, and the number of people who I've served, or have been supportive to people who are serving, who are bringing their care items with them and their fiddle items with them, or drawing at the same time as talking to a counselor. And it's really cool to be able to like there's more permission being created to do all of those things. And I hope that if those people choose to go back to in-person services, they know they can still do that. You can still bring your video game, your Switch into your counseling appointment if you want. And I hope that we continue to support that, because I think there's a lot of young people who in order to open up to you, need to have their hands distracted. And so I think that's something that is really cool. I'm just really excited that people are open to this. I'm really excited to be super creative and just kind of figure it out. I think one of my biggest surprises, and I'm so grateful for it, is just how resilient all the service providers who, like, when you think about how much an in-person therapist actually uses their computer in a day, it's for emails and like for an EMR or whatever they're charting in, and not anything else. So the fact that they figured this all out so quickly and doing so amazing, and sometimes you get things wrong, that's okay. That's why tech people like me are here. It's been really, really awesome. And I'm so grateful that people just kind of care enough about their young people. They're just like, no, we're going to figure this out. And so I'm thankful for that, and really excited to see how we can get more creative and how we can serve more people. And how we can, for me, I think the other part of this work is advocating to bring really good internet access and really good infrastructure to communities all over BC that don't currently have it, so that everybody can have kind of this option to get support from someone outside of their community if that's what they choose.
Perfect, thank you. And last but not least, we have Manuela.
Thank you. So as I mentioned before, I think we can have the opportunity to move from adaptation to digital transformation of mental health in mental health settings. And again, the idea is, technology can play a key part in settings when we are back to be in person, but also new opportunity for providing care in a different way, right? And I'm going back because I always say, I've been in several years that I try to push the envelope on digital mental health. And I also use a definition from a physicist in Canada that talk about innovation around different dimensions. The first one is the curiosity, the strong desire to develop knowledge and learning. And I think, that is our openness to digital mental health and technology, creativity. So the use of imagination to find solution. COVID got us to be very creative. And I think we can do it. We have this energy. We should keep working through this dimension, asking questions and find solution. We definitely need courage, and again, we have been experiencing this within the last few months. So the ability in this case to leave traditional way of doing for new one, again in an ethical way, I would say. And collaboration is really, any of the innovation cannot be possible without the people working together and bringing different expertise to the table. And that's definitely the case for digital mental health. So yeah, that's a possible recipe for us to move forward in a new direction, sustainable direction.
Great. Thank you, Manuela, for those takeaways. 2 quick points here. There's going to be a survey on your screen soon. It's just a general feedback survey for us so we can improve future webinars. We'd really appreciate if you can fill that out. And also, we are entering our Q&A now. We're close to being at our time limit. We're going to go a little bit over for anyone who wants to stay on. And any questions that don't get answered, we are going to address after the call offline, and then send you all a document with answers to those questions. So we're going to make sure everything gets answered. For now, you feel free to fill out the webinar form as it pops up, and let's jump into questions. So if anybody from the panel saw a question in the Q&A box they'd really like to answer, then raise your hand or something. Feel free to go answer that directly. Otherwise, I'm just going to pick one.
Can I answer the I want to answer the crisis one because that comes up a lot.
Go for it.
So one of the things that is, as much as you're aware that you have, when you're supporting someone online, you're aware that you have less cues, the person you're supporting is also aware that you have less cues. And so in my experience with crisis, one of the things that happens a lot online is people just will be more forthcoming with the information that they have, and they will, like I was saying earlier, they share things faster. And one of the things that is really cool about most online technology is that we do collect things like IP addresses and being able to ping, if we collect a phone number, which we do, you're able to ping the tower and you get information about people that you maybe don't think about right away to be able to send them emergency services. But in my experience, like, we have a platform called we use Decima for our data collection, and we have turned Decima kind of into our note-taking platform for the interim virtual care for Foundry. And we're able to co-create a safety plan with someone and push a safety plan out using that platform. And so there is a lot of kind of creative ways around it. I get it though, we're used to like having a bit more power in the situation when you're in crisis in person than you are online. But it's my experience that I think if the young people really want to work with us and they really want to be safe. And so as long as we're kind of respecting like their wants and needs in a crisis situation to the best of our ability, they're definitely going to work with you. And I think that's been the case. We've been able to de-escalate anything that comes in and give people safety plans, and also just always make sure to have a supervisor or somebody else who can join your call to join if that needs to happen. But yeah, it's been pretty good, but I know that the question comes up a lot. So I just wanted to address it. I don't know if the other panelists have anything else to say.
Yeah, I just want to add on to that quickly. So I do, although I deal with groups, I don't deal with people usually in crisis situations or at the same level of crisis. But what I've noticed, and I've had to adapt to it quickly because now all my work is really online, What I've done is really let people feel comfortable and speak personally and get to know each other and understand that we're in a different venue, and that they can they can just really try to act as if we were in person. We don't use the chat boxes so that we can really be present for each other when we're talking in a group together. And if I notice that someone is seeming a little bit, behaving a little bit differently, or, you know, they're quieter than usual, and I'm not sure about that. I'm not adverse to sending them a little quick email afterwards, just saying, glad to have seen you tonight, and I hope everything's well with you, and so on, just to give them an opportunity to maybe follow up on email, or maybe with a phone call, just, you know, to make sure it's all good. I understand this is not the same level of crisis, and it's not emergency crisis situations, but still, it's a way to let people know that we're still connecting, and, you know, if I misread or I didn't read something, that I'm still there for you if you need help. Yeah.
Great. There's a question here about access to tech, which we discussed a bit, but we should expand on here. Have you experienced any instances where young people just don't have access to the tech they need to use these services? And then Ina, specifically, you mentioned group DBT. Could you share more on how that looked and if there were any concerns that came up around privacy and that other people may be in the physical space? So there's kind of two pieces there.
Yes, to the first piece, absolutely. We definitely came across that for several families where they just did not have the means to provide, whether it be a smartphone, tablet, laptop, to be able to engage in Zoom or telephone interventions. We've been lucky. We have reached out to TELUS. They were providing sort of this national campaign of providing phones. We also have a local foundation here that was very, very generous in terms of their iPads. So we were able to choose sort of a handful of families that we were able to provide iPads to. That's probably not a situation that exists everywhere, but I think definitely trying to find creative ways to get people connected. Another thing we did too for some teenagers, especially some youth that lived in sort of very crowded apartments, or were a very busy sort of families where there was really no privacy possible. We would ask them to come in, but then still see them in different rooms. So throughout the pandemic, the rules have been varied, but we could offer them a space in our clinic or in our CLSC, as it's called locally, where they could come in, sit in a room, and still interact with the counselor virtually. But we've had many young people connect from cars, from outside. So definitely privacy is I think it's the biggest challenge, I would say, or the most frequently, where we've had our clinical discussions around that. So especially when you're doing group interventions, and then you've got the privacy of all the members to worry about, that's definitely been a challenge. So we've come up with, as an organization, some sort of like confidentiality agreements, some we would ask them to sign that they really not take as much precaution as they can to find a safe, confidential place to engage in the group therapy, especially. So it's not 100% foolproof, but I don't think any group therapy is in person. With cell phones today, we've often had people record and things like that. So I think it's an additional area we need to be very sensitive about, but I don't think it's impossible. So yeah, I hope that answers the question.
Perfectly. That's great. So Alicia has to drop off the call now, unfortunately. So thank you so much for being on this call, to Alicia. We're going to answer one or two more questions and then wrap up. So next, I'm going to ask Alyssa's question. A big part of youth mental health community-based services are focused around early intervention. Oh, this is partially for Alicia. But Alicia, you mentioned the game groups online, but I'm wondering if anyone sees other opportunities to engage with youth in non-clinical ways online to promote wellness and early intervention. Anybody want to take a stab at that?
I can try to, just to refer, so the idea is to engage with young people on a general wellness socially.
Exactly, and then in non-clinical ways online, which I guess would be definitely Alicia's specialty, but well, anybody can answer this, I'm sure, in some way.
Yeah, I guess my first instance is not that we talk about, and it's connecting to as we know, young people has been more prompt to use digital technology. So I feel that if there was a age group that was kind of ready for the pandemic and technology, was young people. And based on my knowledge in working, I know that everyone quickly shifted their social network to a virtual network. So buying means that, as Alicia said, group of people that the university students start to play, Friday night video game night, of chatting, talking about things and having this meeting, starting to having party online. So it was quite a quick way. So the desire to be together is probably is there, and people find quickly, talk about the ability of gathering in a safe way, and the online environment provide this way. Based on my knowledge of, young people have been partying online, have been doing dance online, playing video game, adults wine and cheese online, and other sort of, so that's kind of, it's a way of us as a human being to try to stay connected and using these. So yeah, I don't know if I'm answering properly, but yeah.
I think absolutely. And one thing I've seen is a club quarantine is called, where people get on a Zoom call and they basically have a big dance party. It's a fun time. I think we've just about run out of time today, so I think we're going to wrap it up there. So I want to thank everybody so much, all the panelists, everyone who joined the call. Any questions that didn't get answered, we are going to address these after the call, and you will get a document. There will be a document published with answers to those questions. So thank you so much again, and enjoy the rest of your day.
Thank you.
Thank you, Matt.
Bye.
Thank you, everyone. Bye.